Well, I'd like to welcome you back to the show. It's my pleasure to welcome back Kirti Mutatkar. She is President and CEO of UnitedAg. She's been with them for a number of years. She joined them in 2001 and served as Chief Financial Officer for 10 years, where she directed all operations of the organization. They reorganized and did a bunch of new things, and then she assumed the role of CEO in May of 2014. She has master's degrees in both finance and microbiology, and she also has rounded out her studies by completing the UCLA Anderson School of Management Executive Program. Kirti, welcome back to the show.
Thank you so much, Andy. That was a great intro. Thank you.
Well, thank you. Why don't you tell us a little bit about UnitedAg, and then we got some exciting news for residents in the Santa Maria area.
That's good. Actually, we just came back from our 37th annual conference and meeting in Napa, and it was actually one of our most successful conferences ever. We had record number of attendees, and I wanted to say a few words about my president's speech that I did at at the conference, because I talked about the secret behind the success of UnitedAg. We have, as you said in my intro, I've taken on as the CEO of UnitedAg 3 years back. And in the past 3 years, we've experienced 20% growth. And so right now we are a $130 million trust, and we are projected to be $140 million trust by end of 2017, hopefully more. And we have over 650 members. So really, really excited about that. And I talked about the secret behind that success. And when I talk about the exciting news that is coming up in Santa Maria, I will explain what I mean by that.
All right. Well, tell us just a little bit about what you do. We have Mike Stoker on the show at least once a month. He follows legislative issues both in Sacramento and Washington, D.C. on behalf of your members, but you also offer insurance services to your members.
That's correct. So we do insurance services, we do advocacy with Mike Stoker, and now we have our relationship with George Soros in Sacramento, and we also do that on a federal level with CJ Lake. So we are involved in advocacy, and we are at this point of the conference, we talked about advancing together with some of the other trade associations, ag trade associations. We're building a group to kind of being about for ag industry, being about changes and working together with other trade associations. So that's one thing that we do. We also have a health plan, and that's been really successful, and that's what I was telling you about earlier with the $130 million trust. Our health plan is through the trust. We also do other events like our HR roundtables and our CFO forum roundtables that we do across the state. And we just this year started a health innovation forum. Through the forum, we are trying to look at innovative solutions that we can bring to our members. And so we are involved in quite a lot of things. We also have an Ag Women Leadership Academy that we started this year that has been successful so far.
Great. Well, let's talk about all that in a little minute. Now that we've got the overview, tell us about this health and wellness clinic that you're opening in Santa Maria.
The Health and Wellness Clinic, and this is at the 2605 Miller Street office that we have in Santa Maria. We opened that clinic is already open since March 1st, but we have a ribbon cutting on April 28th. And the clinic, and as I said earlier in my intro when I was talking about the conference and the secret behind the success at UnitedAg, let me explain that in terms of what the clinic, what we are planning to do, and why it's a little different. The success I feel at UnitedAg is because, as I said in my intro that day in the conference, our stories are based on making the sum bigger than its parts. So I talked about how at UnitedAg we have the 1 + 1 is equal to 3 stories. So in terms of the clinic, when you talk about other health plans, right, so a common story is 1 + 1 is equal to 2. Clinic would be a clinic that is in place to bring the cost of health care down for the health plan by limiting access to care and kind of serving as a gatekeeper. But the UnitedAg Clinic is very different because we are using our clinics to build relationships with our members. So we are more relational in our how we deal with it than being transactional. And what that means, even our provider at the clinic, her name is Elizabeth Keller, she builds relationships with our members, and we're using that to listen to our members, educate our members in wellness and prevention, and use the clinic in a slightly different way than bringing the cost of healthcare down for our health plan, but not just that, but making it more for our members and serving their needs.
So do your members, or do they have to be in ag directly, or can they be ag related? Who qualifies for membership so that they can send their employees here that are covered by your plan?
Anybody who has 50% or more ag-related business are qualified to be members of UnitedAg.
Could you say that again?
50% or more in agriculture-related business, anybody involved in that can be members of UnitedAg. So if we have members who are attorneys, CPAs, or anything affiliated with agriculture, as long as 50% of the business comes in from agriculture, they can be part of UnitedAg.
And so that means so the company joins, and then any of the employees will be able to go to this clinic?
That's correct. And the access to the clinic is at zero copay, and any of the costs associated with the clinic will not add to the deductible. So this is at no cost to the member. The member can come in and get all the services offered by that clinic at the clinic.
Well, that's amazing. Again, folks, let's highlight this. $0 copay, no deductible for services at the clinic. Plus, they're going to have on-site prescriptions and some on-site lab services as well. This is quite a feat.
It is exciting for us, and we actually opened our Visalia clinic 2 months prior to opening the Santa Maria clinic, and it was extremely successful, and our members have used it. And even in Santa Maria, just being open for 2 weeks, we have around 70 members who've accessed it, and the feedback from our members has been amazing because, as you highlighted, it's zero cost to our members, and they're getting a lot of education at this clinic. And also we follow up after the clinic visit to make sure that their needs have been met. So it's building that relationship with them.
Okay, so if our people listening here have 50% of their business is ag-related or more than 50%, how do they become a member of UnitedAg?
They can call a membership department, either send an email to a membership department, that's membership@unitedag.org, or call our general number, and they can be directed to a membership department.
Now, is that general number different than the appointment number for the clinic?
Yes, it is. So we actually, on our website, they can go on our website, and they have a link to have set up appointments for the clinic, or they can call the direct number, that is 805-888-7019.
All right, we're going to take a break. Our guest is Kirti Mutatkar. She is the CEO, President and CEO of UnitedAg, on the web at unitedag.org. You're listening to the Andy Caldwell Show. We'll be right back. Stay tuned.
If your family and your community are important to you, then you are in the right place. You're listening to the Andy Caldwell Show.
I'd like to welcome you back to the show. My guest is Kirti Mutatkar. She is president and CEO of UnitedAg. This is an organization that serves our agricultural community with insurance, advocacy, forums, roundtables, and the like. And she just revealed some exciting news. They're opening a health and wellness clinic. They already have opened a health and wellness clinic in Santa Maria. It's located at 2605 South Miller. It's open to members of UnitedAg. You can join if 50% of your business is ag-related. Kirti, is the clinic open to just the employees of UnitedAg members or their family members as well?
They're family members as well. So it's open to everybody who's covered through our UnitedAg plan. And also, we have a TPA, Superior Insurance Services. Anybody covered through Superior also has access to our clinics.
Great. All right. Well, let's talk about some of the other things you guys are doing. Tell us about today at the Board of Supervisors, in fact, representatives of the California Women for Agriculture. One of my board members, June Van Wingerden, was there talking about, agriculture, and I think some vintners were there, and the Farm Bureau was there, and all that. And anyway, I'd like you to talk about Women Ag Leadership Academy.
The Women Ag Leadership Academy actually came about because when we have a conference at UnitedAg, our approach is as it's a start of a conversation. So we had at the last year's conference in 2016 a panel of women ag leaders, and out of that discussion, what came out of that was a need for a leadership academy where it gives an avenue or a group of ag women leaders who build a network together. So when we found that there was a need for this, we actually reached out to some of our members and asked them and how they would like to structure women ag leadership. And out of that came about this that we launched this year in 2017. Really excited about it because we actually had our third session, and we are going to Sacramento in May. And this group of really strong women ag leaders are learning from each other, are learning from some of our contacts that we have in Sacramento. So we're building that network for women ag leaders.
Now, one other thing that you do quite often is you have various roundtables. So you've got one coming up on April 26th at the Far Western Tavern in Orchid. This one dealing with workplace violence. Who do you encourage to go to this sort of roundtable?
Usually what we do, we encourage the HR directors and anybody involved in HR, but it's more than that. Even if you're not involved in HR, sometimes it's good to get together with fellow HR, other people involved in HR, and learn from that. I think most of our sessions, the way we cater that to our members, are more general sessions and not necessarily just for HR. So this one that's coming up, again, was the way we build these sessions, again, is built on feedback of our members. So we take a session, and at the end of a session, we kind of walk around and take away our members and see what they would like to hear. And this one that's coming up with Kelly McMillan, I think, is a former chief of police of Salinas Police Department. I think will be a great session.
Okay, I'd like to ask you a general question. Obamacare kind of wreaked havoc with certain plans, healthcare plans, because instead of being able to cover people for what is maybe more realistic, everybody had to have the same plan. And that wreaked havoc with a lot of health insurance companies. What do you think, as far as the bill that's being thrown around in Congress right now, being debated in Congress by Paul Ryan, what will that do for agriculture workers?
I think at this point, it is a little bit too soon to see what the impact will be. But what I can say, the way we are creating a culture at UnitedAg, and this happened even when Obamacare came in, just looking at it, anything that comes in, trying to see how we can work around that to better our healthcare for our ag community is what we will work on. So at this point, what Paul Ryan has offered, I think the impact of that is too soon to see how it will impact. But we are working on it to see we are prepared if any direction we want to go, because we are highly flexible and make sure that anything that we do, we make sure we keep our ag community at the forefront and make changes based on that. And even with Obamacare, you're right when you said that this actually limited some of the options that we had for agriculture, and that's the reason UnitedAg got involved in this clinics. We also have telemedicine, which we introduced to make sure that some of the issues that happened with Obamacare, where the deductibles were really high, and it was, for our population, it was really hard with this high deductible plans. We tried to make that as easy as possible. And that's why the clinics with no copays and not going to deductible, or telemedicine, that access is free for all our members. All that was done to help the ag community deal with that. And we will do the same thing if it's in favor of agriculture, what he's laying out. We will adopt that as soon as possible. Or if anything comes out that kind of is detrimental to our community, we'll make sure we take the steps from our end within what the law requirements are and make sure we make it easier for our members.
Now, one of the things, I wrote an op-ed recently for the Santa Barbara News Press, a guest editorial about this whole issue. And that is the misnomer out there is that everybody needs an insurance card in their wallet or their purse. But an insurance card doesn't get you into a doctor if, in fact, doctors aren't taking new patients or doctors aren't taking that particular insurance. What we should keep our eye on the ball is getting people into health care where they can see a doctor, be treated, and not go broke by way of the out-of-pocket high deductibles.
That's a good point you make, Andy, because the Health Innovation Forum that we just launched, this is exactly what we were talking about. And we actually had healthcare leaders and others outside of healthcare across the nation, because we wanted to extend outside of California and outside of our ag industry to see how others are dealing with this and to bring about solutions. And that's what you said is on the mark, because it's not about bringing your premiums down, it's not about having that insurance card, but are we really providing the healthcare needs that our members, are we satisfying that? That's the most important question. So when you talk about Obamacare or you talk about Paul Ryan's plan, actually, when you take a step back and think about it, it's just redistributing on who pays for that cost.
Yep.
But are we really thinking, how does this cost come down? Nobody's thinking about that. Everybody's thinking, who pays for this, right? That's what this is trying to solve. But the real issue at hand is that cost coming down? Do we have access to our providers? And not just access to our providers, but even the supporting staff. Sometimes when you call the supporting staff just to get an appointment, it's an issue, because some of the supporting staff get paid at a different level than the providers, so their incentives are slightly different than the providers. So are we incentivizing everyone so everybody is thinking about the health of the member and not just who gets paid what? All right. And that's a very different mindset approach.
Well, thank you so much. Again, we want to remind our audience of this great news. UnitedAg has opened a health and wellness clinic in Santa Maria. It's located at 2605 South Miller Street, Suite 100. It's open Monday through Fridays. It's open to members of UnitedAg. If you want to find out how to join UnitedAg, you can go to UnitedAg.org and find out more information. Of course, our show goes from Ventura to SLO, so it covers more than just Santa Maria, and they have members throughout the Central Coast. Again, UnitedAg.org and their new health and wellness clinic in Santa Maria. Kirti, congratulations.
Thank you so much, Andy.
All right, we're going to be back with more of our show. Steve Frank's coming up next. Stay tuned.